In this video, I wanted to talk about the issue of wax management. Many people have a difficulty with earwax, and that earwax, of course, can cause problems because if the device is unable to have a clear path to present the sound to the eardrum, of course that's going to be inhibiting the sound and is going to cause either a sensation as if you were getting no benefit or very limited benefit. So what I've got here in my hand is a Q-tip or a cotton swab. The one thing that a lot of folks tell us when we talk to them about cleaning their ears is we ask them first, if they do use Q-tips, and sometimes they, in a very timid way, say that they do, but they know they shouldn't, or something to that effect. And their doctor has said, don't put anything smaller than your elbow in your ear. The reality is most doctors, if any, have never actually explained how to properly clean your ears, and so I wanted to address that today. In reality, doctors aren't trained necessarily in ear cleaning. They are trained in various other medical areas, and but because they don't want to see a eardrum burst by the use of a Q-tip or a cotton swab, that's why they counsel against it. But it would be nice if they actually taught how to properly use one, since the majority of the population actually use them on a daily basis anyway. So I'm going to address that. So you don't want to hold your Q-tip way back here, because of course when you're placing it into the ear canal, if you're holding it way back here and somebody bumps your hand, that could go through the eardrum. So my counsel is to hold it only about an inch away from the end of the cotton swab, and that way you'll never be able to go too deep, even if your hand or your arm is bumped, so you could never make contact with the drum. Also, what most people don't realize is that the wax glands are very shallow. They're just out in this area. In this case, right about here. So we don't have to go all the way down to the eardrum. We just need to swab this area. And when the wax is yellow, which is fresh wax, normally a dry cotton swab is very capable of picking that up. So essentially what would happen is you would hold it again about an inch away from the end, and you would just swab the area in your canal. Okay, what you don't want to do is you don't want to go in and out. Number one, hold it back that far, and you also, if you are holding it properly, you don't want to go in and out, because what that ends up doing is compacting the wax down here next to the eardrum, causing, of course, issues with compacted wax. So again, just hold it about this far, about an inch away from the end, this end of the cotton swab, and just swab this area right here. And of course you might have some, if you just got out of the shower, you can maybe just get some of the moisture out of your canal, but you never want to go any deeper than that. And anyway, that is one of the safest ways of cleaning your ears, and we recommend that if you're going to use Q-tips on a daily basis, that you use them safely. And certainly for the greatest success of utilizing and wearing hearing aids, if you can keep your ear clean and your canal clean, your devices will work much more successfully, will last a lot longer. You'll have much greater happiness and appreciation for your hearing aids, and a lot less maintenance issues. So We hope that this video has helped you to learn and understand the best method for keeping your ears clean.